My name is Ronald Rand. I just turned 79 on the 18th of June. I live in Long Beach, California. I've lived here for almost 40 years. My bike, the history of it goes back to when Courtney, my oldest daughter, and I would ride, but it was an old Peugeot, and they're pretty heavy. And so the kids decided I needed a light bike. So in 2007, they picked out a red Giant, that's the brand name of it. And I've ridden every single day since then. That was July the 29th, 2007. I thought I was having sciatic problems, and the doctors suggested MRIs to check out what was going on. And so when they found bone on bone in my left hip, and I wanted a referral close to here, they recommended Hoag and gave me a referral to Dr. Hunter. And so I met with him, and they did x-rays at the Institute, and sure enough, my left hip, no cartilage at all. And so we had a very, very good meeting with myself and the doctor, and he recommended hip replacement surgery.
Got it. We'll take good care of you, okay?
Thank you.
All right, you got it. Did you ride this morning? All right.
Hey everybody, I'm Michael Hunter, one of the orthopedic surgeons at Hoag Orthopedic Institute. I focus primarily in hip and knee replacement. Today we're going to be doing a surgery on one of my patients, Ron. We're doing a left anterior total hip replacement. He came to me, he's a very avid cyclist. He's been riding his bike every single day actually for the last 17 years. And he came to me, obviously he had the goal to continue riding his bike. So he actually rode his bike this morning, which is incredible, before he came in for surgery. He was very adamant that he wanted to continue his streak of 17 years without missing a day. So his goal is to go ride tomorrow morning. Again, it's a little outside our typical protocol. Most patients are not riding their bicycle the day after they get a surgery. All right. Here we go. Okay, everybody, we did a timeout. We're doing a left hip replacement. We've given preoperative ANSEF and TXA. We've gone over allergies. Any other concerns? Everyone's on board. We're doing a left hip replacement. All right. Okay. All right, now we're done with surgery, so we're going to go call the family, let them know everything went great. So I think that's really important, so that way they're not concerned and worrying about him. So that's what we're going to go do right now. I think he did excellent. I think he did really good. I'm happy for him. I'm excited he's going to be able to have the quality of life that he wants. I mean, that's why we do the stuff that we do. And surgeons, we get to come in contact with people like this every day. So I'm excited to get to share the journey with Ron with you guys.
Well, we're now a couple months after the surgery, and I am still in awe of the whole procedure, how it's taken place, and the healing, and going through the physical therapy was, it was tough to do, but I could see the progress every day as they worked with me on the physical therapy. Riding the bike is just so easy now, and it's comfortable, and I've enjoyed every minute of it. It's always the wind. I love the feel of the wind when I'm riding. It's been that way since way back when I started, and it's even more so now. It's just great. Well, going into the surgery, I had a streak of 6,420 days. And immediately after the surgery, I felt like I could just keep right on going. And I had ridden that morning, so the streak was intact. The next morning, it was very obvious that it wasn't a good idea to try and get on a bike. There was no pain at all, but the swelling started in the leg, as I had been told it probably would. And so I just wanted to exercise good caution with the new hip, not try and push it. But in less than a week, I was back on the bike and riding. Just every day that I get on it, it's great. It is fantastic. Every bit of exercise, workout that I get on this bike, I know is strengthening me, and I think that and the work of the Hoag Orthopedic Institute has got me definitely back on the road.